The intervention that we looked at was play. So we are looking at play-based occupational therapy for a pediatric client.
I'm Rachel.
And I'm Amanda.
So our client is a 47-month-old male, so he's almost 4 years old, and this means that he was previously independent with toileting, and because of his condition, he isn't now. Typical play for a 47-month-old really includes complex imaginary play, constructive play, rough and tumble play, and social play. And these are some milestones we want him to get back to performing in. His diagnoses that he has is acute myeloid leukemia, septic shock, and cardiomyopathy.
And as I already said, we are looking at play, which includes play participation and exploration. And then because he is in the hospital setting, commonly you're looking at ADLs as well. And this was what the parents' goals were too, were focused on toileting, functional mobility, and dressing. The two models that we decided to look into and used for this intervention and our sessions were MOHO, which you guys are all familiar with, focuses on volition, habituation, and performance while working on the areas like routines, roles, and habits. And then the area of MOHO that's unique compared to other models is how MOHO does expand on the client's personal experiences and their own viewpoints of their abilities. With this client specifically, I'm going to dive into volition to try to figure out what really motivates this client since he often does cry during his sessions. And then the other model we looked at was behavioral activation model, which focuses on enabling individuals with identifying, scheduling, and engaging in therapeutic occupations in client-led interventions that can be repeatable.
And now we're going to show our demonstration. Now we're going to dive into the evidence for this intervention. Brick et al. Discussed how the four main components of behavioral activation really include value identification and goal setting, as well as activity scheduling, activity monitoring, and skills training. So these all can really increase participation in meaningful and purposeful activities. And through our skilled occupational therapy, we can schedule this throughout the day for this client. And because the client has shown interest in stuffed animals since he had a stuffed animal in the first session, we decided to include stuffed animals to ground our intervention in play. And these stuffed animals and a chart to reward the client are both positive reinforcements within the environment.
And then Van Brick et al. Looks at play within children through a qualitative study, which they conducted some semi-structured interviews with therapists working in the hospital setting with clients that have these life-threatening illnesses. And then the 3 interviews that were conducted, the first one being the occupational therapist, just like getting to know their background, like where they've worked, like the settings and how long they've worked in them. The second one was telling stories about clients who are experiencing life-threatening illnesses in general. And then the third is going more in depth on one specific client's story and giving a lot of details about that one. The themes, there are a lot, and I'm just going to name a few themes that were identified, but one of them being reimbursement can be very difficult for play interventions. So it is often used as a means, which we're kind of doing in our interventions a little bit too. The general importance of play for children, since it is their main occupation. Challenges with getting clients to play based on their conditions, because they may be very exhausted depending on what their condition is. And then playing just for the sake of play if they're at the end of life. Then the second article that I looked at was by Mohammed Ali. And then this is a single subject design looking into 2 specific therapists and how play interventions can help decrease the discomfort in the hospital settings. These could be things like pain or fatigue and anxiety. And then the beginning of this study included assessments that look at those specific areas, pain, fatigue, and anxiety. And they did find that using play interventions does decrease that discomfort in those settings.
And finally, Coleman et al. Also looked at how occupational therapy can increase participation in play, leisure tasks, and also practicing fine motor skills. And this is all done throughout purposeful activity, ADLs and IADLs, and also improves strength for pediatric clients. And the clientele in this study were individuals that had cancer and also have had hematopoietic cell transplantation, which is a bone marrow transplant. This is pretty similar to our client's diagnosis of AML.
So some clinical reasoning questions, the first one being, how would you change this intervention approach to better fit a different setting? For instance, if you were in an outpatient setting instead of the hospital.
Another one is, how do you think you might feel if you were this client?
Another one would be, how will you ensure that you understand the client's emotions at this time?
And how would you go about changing your intervention on the spot? What if this client's oxygen saturation levels began to drop again?
Thank you for looking at our presentation.